Okay, so this is the no, this is AD. This is the AD specification. Normal. See, remember when we were discussing about MH and CM, Priyanka, you mentioned a point that why is this not in the specification, but this, I mean, this particular variable is something which is derived as a part of the specification. Like it is not now. It is not the variable is not present in the SDTM IG 3.3, but it is present in the specification for this study, and also we have derived it using SAS. Because see,
Yeah.
SDTM IG 3.2, it was one version previous. So every year, probably I don't know, every year or every subsequent period of time, this SDTM IG is revised. Just a minute. Okay. Just a minute. This SDTM IG is basically revised. I mean, they see that whether this variable is required or not, or whether there is any sense in keeping it or not, or if that can be merged with any other variable, so on and so forth. So it keeps upgrading as clinical trials become sophisticated, as they become streamlined. I mean, statistical analysis. I mean, no, not statistical analysis. Basically, standardization becomes more and more concise, so that the entire trial data can be concised in a particular streamlined manner and submitted to the FDA. So these will keep on changing and updating. So now if we see, now considering the AE domain, if you see here, we would be considering the raw.a. So there is a raw.a which is there. Let's quickly check. So there is an AE folder which has the raw files. This is the one. And see, it is the same thing. Site ID, subject number, visit name. AE term, AE start date, AE start time, if it's ongoing or not, what is the end date, end time, severity. So these are some of the patients who did not have an adverse event. If we go down, these are mainly the patients which has adverse events, so we will be focusing on these. Clear? Any questions as of now?
Yeah, no.
No?
No.
I'll go ahead. Yeah. This is easy, you'll get it. Okay. So required data from raw.a. So we will need raw.a variable. So length, use subject ID 40 I mean dollar 40 AELLT AED code. So all these lengths we have defined first. Now if a term not equal to null, because because we in the A domain we would need the A terms, correct? So all these people who does not have an A term, we would not need them. The people who has AE, who has experienced adverse events, we would take them into consideration. So if A term not equal to null, then what study ID is this one, EP, because this is hard coded. If you see this one, domain will be AE. Okay, if subject domain will be AE. If subject number not equal to null, then subject ID is study ID and subject number. As we were doing it previously also, this remains the same. If not missing A term, then A term equals to uppercase A term. So if A term is not missing, then A term will be uppercase of A term. We cannot have them as lower cases. We cannot have them as lower cases. Is there something mentioned here? Copy from source variable and uppercase. See, copy from source variable is what? AE term and AED.AE term. So we would have two source variables, AE and AED. Have we taken AE and AED both here? Just check. Let me check once. Going forward, if you have mentioned AED here. No, I don't think AED is there because okay, we have a term here. Let's see. Why we should be taking required data from AED? Okay. 33. No, we haven't considered it. Probably because we don't have the data correct here in this. Here we have given A term as this elevated ALT level, but probably because we don't have the rest of the columns, A severity and so on and so forth. If you see here, the data is half-hearted. A term we have, A estimated, A start time we have, start date we have, start time we have, is ongoing or not. If end date, end time, and that's it. We have till that. We don't have more. But actually, let's go on with the AE only, the part we have. So if not missing A term, then A term is upcase. Okay. Now AE LLT equals to strip LLT name, AE LLT CD input LLT code best stuff. We have to have it in characters. So let's see this. A term we have it. AELLT is lowest level term, raw c.ae.llt. Copy from source variable. Okay. Where is the source variable? We already have it here. AELLT. LLT name we have, LLT underscore name. So these are basically what? So the A term, the A adverse event term is actually linked to these meta dictionary terms. This is LLT. This is decode. PT will be basically represented as AE decode. LLT will be represented as AE LLT. HLT will be represented at AE HLT, and they will have a subsequent code to them. That's it, nothing else. There's no rocket science here. That's the simple thing. So there would be a medical coder who would be coding those terms, and that would be put up in this SAS raw data set. And from there, we would be linking these MEDRA levels, LLP, PT, and HLT to the standard SDTM AE data set. So AE decode, if you see, strip PT term. Similarly, AEPTCD will be input PT code to best. Similarly, we will have it for AHLT, HLGT, HLT, HLGT, bot sys CB, SOC, SOC. Done. So we have linked all these dictionary terms. Next, what we have? SOC, SOC. We have it till there. Next, we have is ongoing. Let's see AE ongoing. Where is it? AE ENRF. End relative point. What do we have? If ongoing equals to F, then AE ENRF should be ongoing. Fine. Do we have AE ongoing here somewhere? We have AE ongoing here. So are these events still ongoing or not? That's what they are wanting to check. So if AE ongoing equals to else, then AE ENRF is ongoing. Same for severity. If SA equals to N, then AE seriousness. If serious adverse event is no, then seriousness is no. If serious adverse event is Y, then seriousness is Y. Do we have something like that? Is AE ACR. Correct. Copy from source variable and assign the values as per control terminology. ASAN, then ASARN, ASAN. Simple. Correct. But we have to check the control terminology as well. So later on, check it if seriousness is assigned as N and Y, or it's considered as no or yes when we are standardizing. Then ASEN, if it's no change, then dose not changed. If ASEN is withdrawn, then drug withdrawn. If ASEN NA, then not applicable. Any other action has been taken. What is the action that has been taken as a part of the A which has happened? So we get this code. And the last one is AE CON PRT not equal to null, then AE and CRT equal to 1. Check this. Oh, concomitant additional treatment given. If A is CONTRT equals to X, then A and TRT equal to Y. Let's see. If A and COT is equal, then Y. Let's quickly check here. A and CONTRT. We have something here. A and CONTRT, yes. If A and CONTRT not equal to null, then A and CONTRT equal to Y. Okay. Then A and CONTRT is, these are the people with adverse event who has been given a concomitant medication. Remember when we discussed that concomitant medication is not only if a person is taking medicine before the study drug, that would be included. If a person is taking a medicine before the study drug, only that would be included in concomitant or prior medication. Also, as a part of the study trial, if a person has an adverse event and that person is given a drug, then that drug also, that is, I mean, just to give an example, during the clinical trial, the person has a drug, the person has got high fever. To lessen the high fever, the study team has provided a drug to the person. So that drug, how much dosage has been given the drug, at what time of the day, how many, through which route, oral route or infusion the person has taken the drug, everything will be mentioned in the concomitant medication domain. So there's a link between AE and CM here. So here if you see, concomitant medication here is concomitant medication, it's given or not. If it's X, then if it's X here, that means this particular person who has got the problem or who has faced the adverse event has been given a study drug. What has this person faced? Let's check once. It's a mild adverse event, acute bronchitis. So that person has been given a drug to counter this. And any other treatment has been given, AENOACT, which is AEAC other. Any other action has been taken other than given drug. So if AENOACT is none, then no action has been taken, other action. If it's not missing, if not missing this, then a medication has been given. If this is not given, then a procedure, a surgery has been done. And lastly, not lastly, not missing AACTUH, subject discontinued from study. Because of the adverse event, what are the other actions that have been taken? See, this is absolutely clearly given here. Any other action has been taken or not. So if not missing this one, then other action is none. If not missing ACM NUM, do we have something like that? Correct. See, AECM NUM, AENOACT, AE Act procedure, this one, all these things we are considering. So in that case, if you see, this is the formula that we have given. So some, nothing has been done, no other action has been taken. For some, medication has been given. For some, procedure surgery was done. Some subject discontinued from study, and the other action was taken for some else. Then comes relation. First of all, tell me, I'll take a pause here. Any questions here? Priyanka Shagupta, any questions here?
Yeah, no, no.
Huh. Then we are doing as and when it is present. For relation, if it's real equals to unlikely, then unlikely related. Means the adverse event which has happened, which is not likely, I mean, that is not related to the drug. Some else adverse event has happened probably because of which, I mean, this adverse event has I mean, some other event has happened because of which this AE has been reported. AEL is possibly then possibly related. If not related, not related to the study drug. If AEL is definitely, then definitely the adverse event is related to the study drug. And if it's probably, then might be related to the study. What is the outcome? Recovered is result. If AE out is recovered, then AE out is recovered result. If AE out is no TREC, then not recovered, not result. Simple. Now comes these concepts of AES Kong, AE disability. So what actually happened as a part of this adverse event? So if AE Kong not missing, then AE Kong equals to Y, else AES Kong equal to none. Let's see what is AE Kong and AES Kong. These are the ones. AE Kong. Congenital abnormal or birth defect. Congenital anomaly or birth defect. Did the adverse event result in any congenital birth defect or anomaly? No. If it's not AE count is not null, then AES count is Y, else AES count is null. If not missing, is there any disability which has happened? Same thing is there. Is there any death? Is there any hospitalization? Is there any life-threatening things? AES life is what? Let's check. Is life-threatening, or say lastly, it is other medically important serious events. So we do this because this is absolutely present here. These are different variables, but all the same concepts, all the same formula. So we take it from a disability, a death, a hospitalization, a life. Let's see from the raw data set where we have this a a death, a life, hospitalization. If hospitalization, this is the hospitalization. When is the hospitalization date? Disability is from this one. Now we are coming to start date and time. It's simple, and not meeting time, we'll do this. If not meeting ASTD, we'll do this. Same, start date and start time. There's nothing rocket science here. Same for end date and end time. So let's execute this and check how it comes out. A1. Use subject ID, AELLT, AED code, AHLT, AGLT, all these things have come up. So all these are also there, but one second, did we already drop? Okay. So all these raw data sets are also there, but apart from that, we have also included the standard ones. So later on, as we do, we'll just keep the standard ones, that's it. And we will just ignore the ones which are there as present in raw data. So here we have. If you just check till AST, DTC, and A and ACC, so these are the style, or these are the standard variables that we have. Seriousness, other action, outcome. If you see, these are also some of them. AELTCD, APTCD, AHLGT, what is this, AENRF, AESCOM, all these things are also there. Then we have the epoch. Epoch calculation is the same thing. AC1, we take it 1, we take the one which is 1, then take the 2, then take the 3, then we concat them, and then afterwards we just check if start date is within the follow-up period, then it's follow-up, epoch is follow-up. If start date is between the screening periods or treatment periods, it's a treatment. If start date is between the screening periods, we will be having it screened. Simple, nothing else. And then we have the study date. Then we have the study date. If the RFST DTC is within AST DTC or greater than 1, then we have the study date. If it's greater less than 1, then we have a different formula for it. Simple. Let me quickly execute this as well. We straight away look into AE4. See epoch. So this adverse event for this particular person happened within the treatment period. That means we can expect this might be related to the study drug. Might, it should be, right? It should be probably, or I mean, it can be anything. Like even if it's happened within the treatment, it should be related to the study drug. There is no hard and fast rule like that. It may be, may not be. This is related. I mean, this happened when it was follow up. All these happened during treatment. Some of this happened during screening. So these are the epoch that we have. And the study day, if we see, Every day, where do we have start date? It is like 2, 6, 13. These are the numbers we have, and this is the study end date. And lastly, we have the sequence. Why we have the sequence is, let's see, is there a same patient? Yeah, let's see. 104007, 104007, 104007. So this patient has adverse event 3 times during the entire trial. 1007 patient ID has experienced adverse event 3 times. So how do we represent that? We have this data. Probably these will be different adverse events, which yes, we know. But the more effective way of understanding is the sequence, which is this. So see, by U subject ID, AESTDTC, AENDTC, and AE turn. First, we are sorting by this. Not sorting basically, we have sorted by this first, and then what we are doing? If first dot U subject ID, then AE sequence equals to 1, else AE sequence equals to 1, YE plus 1. So when it encounters the first U subject ID, so if you see here, this will be sub AE sequence 1. Next, it would be A sequence again 1. Next, it's a new patient, so it would be A sequence 1. Again, it would be A sequence 2 because it is the same patient. Then it would be A sequence 3. Then this will be A sequence 1. Again, this will be A sequence 2. This will be A sequence 3. This will be A sequence 4. This will be A sequence 5. Then it will be again A sequence 1. So this sequence will help to understand that, okay, this subject has, the same subject has experienced adverse events multiple times. Same with concomitant medication. That's why the sequence is not there in the DN. It comes up with adverse event, concomitant medication, medical history, where there is repetition of events which has happened. Okay. So now if we execute this, AE7, data AE, so this is the final one. Study, domain, new subject, AE sequence 1, 2, 1, 1, 1, 1, 2, 3, 1, 2, 3, 4, 5. This is 5 because this is the same person has having so many adverse events. AE term, AEHLT, AELLTCD, AED code. So everything now falls in place. Any questions? Priyanka, Shagufta,
Can you show the A sequence one more time?
AE sequence is here.
Yeah.
Okay. So 104001. This is the first sequence. See the formula, check the formula once. So what we are sorting by, we are sorting by subject ID. We can only sort it by subject ID as well. It's not needed to sort it by these, but we have sorted because these are some of the important variables. Start date, end date, A term. Then if first dot U subject ID, this is a first dot last dot if you remember.
Yeah.
Uh, if you remember, find it, just go through it once. First dot U subject ID, if it's first dot U subject ID, this is the first one. Then A sequence equals to 1. So we have A sequence equals to 1. Else A sequence plus 1. A sequence plus 1. That means this is the first occurrence of the U subject ID. So A sequence will be 1. But the next one is also the first occurrence of this particular U subject ID. Is it yes or no?
Yeah.
Then it's again 1. Then 007 is again the first occurrence of this particular U subject ID 104007. That's why it's
Yes.
1. But this is the second occurrence of this U subject ID, correct?
Yeah.
That's why it's 2. Again, this 104, 104, and 104007, this one, this particular row is the third occurrence of this U subject ID. That's why it's 3. That's why sequence is 1, 2, 3. Again, when you go out, I mean, when you consider the next 105001, this is the first occurrence of this particular U subject ID. That is the formula. If first dot U subject ID, if you're encountering first of its kind, then you part it as 1. If you are encountering the same U subject ID again, then AE sequence plus 1. That's why it's coming 2. If you are encountering a completely new different U subject ID, it will be 1.
Yeah. Got it. Yeah.
Got it? Fine. Okay, I've shared this with you. Let me stop the recording.